Today we're going to discuss older adult driving. We're going to define the population of older adult drivers and discuss risk factors and dangers associated with older drivers. We will list statistics regarding older adult drivers to teach the community how to appropriately help and educate older adult drivers. We will then determine how many of you know older adult drivers. We're talking about the population, according to the AAA and the National Institute on Aging, of 65 years and older. In 2009, there were 33 million licensed older adult drivers. By the year 2030, there will be 70 million licensed older adult drivers. As the population continues to age, issues related to older adult driving will likely become more prevalent. This will be an issue our society will always have to deal with. Some statistics of older adult drivers include the following. Involvement in fatal crashes begins to increase among drivers ages 70 to 74 and are highest among drivers 85 and older. Older adult drivers rank second when it comes to the road death toll, only behind young drivers aged 15 to 24. In 2014, more than 236,000 older drivers were treated in emergency rooms for motor vehicle crash injuries. Risk factors and dangers. Older adults typically suffer from the following. Slower reaction times. This can affect their ability to stop at red lights and lead to accidents where they don't stop in time. They may even hit pedestrians. Limited mobility. They don't have full range of motion to turn the wheel or may have difficulty reaching the brake or gas pedal. This may be due to arthritis. Visual impairment. They may have a difficulty with depth perception or seeing traffic signs and signals. Heart disease, stroke, and dementia could also affect their driving. Dementia could lead them to get lost even on roads they take often. Impairment due to medications. Medications may affect them in many different ways, including drowsiness or low energy levels. Attention span deficits. They may lose the ability to focus on the road and what's ahead of them. Hearing loss. Elder adults may lose the ability to recognize emergency vehicle sirens and horns from other vehicles. Maintaining independence. Driving is a critical part of an older adult's independence. It allows them to get to the grocery store, visit friends and family, and participate in hobbies and other activities. It is very important to give them the sense of that independence to ensure they can do the activities they enjoy. Older adult drivers can maintain their independence longer by doing the following. Wear seatbelts at all times. Avoid driving at night when vision may be low or during times with heavy traffic. Regularly get vision tested. Exercise to maintain strength and flexibility. Talk to doctors about medications and their potential side effects and dangers that may be caused. Have driving skills checked by a driving rehabilitation specialist, occupational therapist, or other specialist. Having the talk. It is very difficult for everyone when a loved one's keys need to be taken away. It is for the safety of everyone on the road, but the individual's feelings must be taken into consideration. When having the talk, avoid confrontation. Try to have a one-on-one conversation, as involving too many people may become overwhelming. Discuss the driver's skills rather than talking about their age. Be positive and supportive. It can be difficult to give up independence. Focus the conversation about the driver's safety. The goal is for the driver to continue their daily activities while staying safe. Educate the driver about public transportation, Uber, and other transportation options that will allow them to maintain their independence. Who can you help? Please think about this for a moment. Is there someone in your life that you may need to educate about the risks of older adult driving? How would you go about having the talk to take away a person's keys? We want to thank these organizations for allowing us their resources.